Greeting members of the deaf and hard of hearing community of Rhode Island. Tonight's discussion is going to be on the Omicron variant. That's Omicron, O-M-I-C-R-O-N. You may be wondering what this is. It is a new variant that stems from the original COVID-19 that has just been identified. Now, you've probably seen in the media or have heard about it on the news or people talking about it, about the Omicron variant. So I'm going to explain briefly what we need to do at this time to keep that variant at a minimum. So let me give you some background information first. The Omicron variant first showed up on the scene in South Africa back on November the 22nd. The South African Health Organization quickly notified the World Health Organization in terms of this new variant. And the World Health Organization represents the entire world in terms of establishing vaccines, guidelines, and so forth. The United States CDC and the Rhode Island Department of Health usually follow the guidelines that is established by the World Health Organization, which has been backed up by scientists and research. And they have definitely concluded that the Omicron is a variant that has come from COVID-19. And it is now at the level of what's known as a VOC, which is a variant of concern as of November the 29th. Now, why did they pick that name, the Omicron? If you recall previously, when COVID-19 first came on the scene in the beginning of February of 2020, they identified these variants by numbers, numerically, like B.1, B.1.4, B.1.63, and so forth, with various numbers. That is really the language that the scientists use, and they understand what that means. It's a coding system. However, that information is not very friendly for the public to understand what it means. So the World Health Organization decided to change the labeling of how they identify these for the general public and use the alphabetical system alphabetically, such as the Greek alphabet. So COVID-19 plus the variants. So the first one was known as the Alpha variant, which is Alpha, which was COVID-19, which was the beginning. And if you remember, then we had the Beta variant afterwards, and then the Delta variant, and then the Eta variant. And then we went down the list and we had the Gamma variant, the Kappa variant, the Lambda variant, the Mu variant. Now it's called the Omicron. So I'm going to share a little PowerPoint with you in terms of the Greek alphabet, where it shows these variants by name, so you can understand how they started to label this. Now, the Omicron variant is concerned by the World Health Organization because it is a VOC, a variant of concern. It has risen to that level, which means that the World Health Organization personnel are constantly looking at this very closely to make sure that this does not become very severe in its transmission. Now, the variant of concern has some very interesting variants of high consequences in terms of what scientists, how they rate these things. And basically, it's based upon the severity of how it infects people to illness, how fast it spreads, and if it's a low risk or a high risk. Right now, it's in the middle. It's classified as a variant of concern, so which is pretty high. We can't just overlook this. Now, the United States at the current moment, we only have one variant of concern, and that was the Delta variant that we've been dealing with for the last few months since the summer. And the numbers are starting to increase slightly as a result of that variant. Now, in the state of Rhode Island, I would like to show you a graph. Okay, this is a graph of the last 6 to 8 weeks. Now, if you've noticed this graph, take a good look at it. They are in 3 categories: the percent positive by week, new hospital admissions by week, and new cases per 100,000 population. These are the criteria that we monitor these variants. And as these numbers are rising, there's something missing. Why is there an increase? Why is there a spike? Now, for the last 2 years, the numbers should be going down. And COVID, was going down because we had the vaccines, that we're dealing with all the variants, and we were suppressing it and suppressing the transmission, but yet the numbers are going up. And there are several reasons why this is occurring. We have a large population who have not been vaccinated yet. And as long as that population is not vaccinated, our immune system, for those who have been vaccinated with the first 2 vaccines, whether it's Pfizer or Moderna, our protection rate is going down. It's diminishing because it's already been past 6 months since we've had these vaccines. So if you recall, when we first had these vaccines, we were 100% protected, about 95% protected. Now that 6 months have passed by, they're showing that the protection rate is going down to almost 60-something%, which is half of what it originally was. So we are encouraging everyone to go get their booster to, boost up their immune system back up to 95%. So that is what the purpose of the booster is, so that we can maintain our protection against those who have not been vaccinated. Now, sadly, this infectious rise is hitting our younger population. Now, at the press conference yesterday, Governor McGee and Dr. Alexander Scott said for the last 4 weeks, from Halloween to Thanksgiving, they've noticed an increase in numbers. Now, I'd like to back up for 1 second. In reference to the positivity rate in Rhode Island, if you look up there on the top, the positive percent has gone up to now 4.9%. That is the new positivity rate. That is not good. Now, according to the CDC guideline, it should be 1% or less of the total population. So, for example, in Rhode Island, we have roughly around 1 million people living in the state of Rhode Island, which means that for the COVID transmission, for every 100,000 should be 1% or less. Okay, and the lower the number, the better it is. And that's how we can stay on top of it and control the variant and control this virus. So 4.9% is high. We need to get that back down below 1%. Now, the second category is talking about the new hospital admission rate by the week. So now we have 127 beds that have been occupied by people who are infected with COVID. Now, I remember when we first started making preparations, we had made plans for 170 beds for COVID patients only. That was just a rough estimate that we set aside for that. And then we also had the temporary housing, hospital facilities that were set up. And the numbers started going down. And then we took away those portable hospitals and taken them away. But the numbers of 127 is going up now. So that means it's starting to double. So if we have to have other patients who need medical services, such as surgery or other things that are unrelated to COVID, they will not be permitted to come into the hospital because the occupancy of the hospital will be occupied by people that are, infected with COVID, such as ventilation machines and so forth. So we have to get that number down so we can make the hospital availability beds for all patients. Okay, and then the last one is new cases per 100,000 population. Okay, so this week it showed up at 317 out of 100,000 people. Now, there are two different systems of measurement. Okay, the first one, if you recall, is by total population. But this third category is per 100,000 people. So if we keep the smaller the state and the larger the state don't have the same proportions. Okay, so this is a guideline. So how we measure for Rhode Island. We have 317 new cases, and that's not good. That's per 100,000 because they want it to be 1%. So what that means 100 out of 100,000, but we're already at 317 out of 100,000. Okay, and that is because of the Delta variant that we have in the state of Rhode Island. Now, almost 80% of the people are not vaccinated. Now, those who have been vaccinated, you know, they have contracted, you know, this variant, but those who are not vaccinated are at a higher risk of receiving illness as a result of this. And mostly where they're beginning to see this, as Dr. Alexander Scott stated, was that it's hitting our young population. So from Halloween to Thanksgiving, during that time period of 1 month, children between the ages of 5 and 9, the positivity rate has doubled. Now, I don't have the exact numbers with me, but it has doubled within 4 weeks. The next category is from the age of 10 to 14, has tripled in terms of contracting COVID symptoms. So more and more pediatricians are really paying attention and looking closely at these numbers with the young population, you know, because they've noticed an increase with patients going into the doctors and stuff for treatment. And there is a concern there. So the more children that are sick, that means that they're going to miss school. They're going to miss out on the opportunity of education. They're going to miss out on gatherings for the holidays, the upcoming holidays, to be with friends and family because they're sick. So Dr. Scott is asking all of us and parents and guardians of these children to please go get them vaccinated as soon as possible. Do not delay. It is with a sense of urgency. You can see all the reports and the information based upon the vaccine since January, I stand corrected, since December of 2020 to the present, that the percent has been over 95% successful. Okay, so those who have been vaccinated, 95% successful rate. Okay, it shows that less and less people were getting infected, but the children were getting it because they were not vaccinated. And they're also getting it from the family members of the adults who are not vaccinated. And they're passing this on to the children, to our younger population. So these are all factors that we have to take into consideration. Now, Dr. Scott also said that because of the Omicron variant, it's too early to tell whether that's going to have the same impact as the Delta variant. The World Health Organization doesn't know as well, but we do know that what's happened in South Africa has suffered severe consequences. And that is because they only have 25% of the population vaccinated in South Africa compared to the United States, where we have 70% of the population vaccinated. So 25% of the population in South Africa means that the infectious rate of spread of disease is hitting 50 people out of 100,000 easily in just 1 week. Now that's doubled to 220 out of 100,000 people in 2 weeks. That's more than a 400% increase. There's a big concern for that. Now, there's no proof or results that it's causing illnesses or side effects that can actually kill people. We don't know that. As I said, it's too early to tell. But the World Health Organization is monitoring this very closely. Now, right now, worldwide, we have 8 different vaccines that are recognized worldwide that have been approved by the World Health Organization that is preventive for COVID. So right now, they're concerned about the boosters, that maybe they may have to make an additive to it so that it can protect us against the Omicron. As Dr. Scott has emphasized, and Governor McGee, you know, and as I'm telling you, and we're being very repetition about this, follow the CDC social distancing rules, please. If all of us follow those guidelines, the numbers will go down. Okay, it's been almost 2 years now since we've been battling this. and the rules have not changed. But remember, masking up. I know that, recently, we're gotten more relaxed. And right now it's not mandatory that we have to wear these masks like it was before last year. It's basically voluntarily, but it seems that we have become too laxed and let our guard down. Do not forget about the people who are asymptomatic, meaning that there are many of us who have the COVID variant, but don't have the symptoms. We are carriers and passing that on to other people. So Governor McGee and Dr. Scott has saying that we should mask up, double down, and even mask up indoors as well as outdoors. And be aware of the large public events that we are going to, that have been taking place. And they've been monitoring, and it seems that what's happening in large gatherings now, only 20% of the population in large gatherings are masking up. 80% of the population is not masking up. So Governor McGee and the Department of Health is saying that those numbers should be reversed, and that 80% of the population should be masking up and 20% should not be wearing a mask if they choose to do so. Okay, and this is because of the Delta variant. That's gone up. Our numbers are going up because of the Delta variant. So we are working diligently to prevent that from increasing. It's still new, but it's coming from the Delta variant. So we are all encouraging each other, please wear your mask and get tested as often as possible. Every 2 weeks, get tested. You may not feel that you need to be tested. You may be feeling fine, but still just get tested just to rule out the possibility that you may have the COVID variant. Okay. And antigens, and making sure you keep, proper hand washing, sanitizing, keeping your home cleansed down, going into public places, restaurants and stuff. They've all been doing it. Stay steady on that, keeping everything very clean, hygienically clean. And stay away from large gatherings if possible. If you go to a large gathering, mask up. Whether you're vaccinated or not, mask up, please. Now, with the holidays coming upon us right now, we've already seen that we've gone through, Halloween and Thanksgiving. We have 2 more holidays coming up between Christmas and New Year's and Hanukkah and Valentine's Day. We have quite a few events coming up, and now the winter's here, and then more of us are going to be indoors. And, we're concerned now because the Delta variant numbers are going down. That's okay. But the Omicron, right now we've had 1 case that was isolated in the state of California from a traveler. So we're watching these 2 variants very closely. Now, for those of you who are unvaccinated, the Department of Health is asking you to please get vaccinated, please. Again, you can read all the reports, the information, the results of these vaccines that have taken place. The success rate is extremely high. And the percentage of people, contracting this a second time or dying from it is like 0.1%. Yes, there have been a few people that have been impacted, but the numbers are minute. But that's because they had underlying conditions, and scientists have identified that. Please go get vaccinated, not for yourself, but for the fact that you're protecting others around you, especially elderly people, your grandparents, your aunts and uncles. Vaccinate to keep them protected. Okay, and parents of the children who are from the ages of 17 and below, please bring your children to the pediatrician and get them vaccinated. Right now, the entire Rhode Island school system is providing these vaccines for these young adolescents that don't require a lot of appointments going to hospitals and doctors. You can do them at your local school district. Okay, so you don't even have to be a member of that school. The Rhode Island Department of Education has a website of listing all the schools where the vaccines are accessible. So if your child is not in that school system, they can still go to that facility and get their vaccine. And if you're not convinced, talk to your family doctor, talk to your pediatrician. Get a big picture of what's going on in the future in terms of this vaccine and COVID. We want to see these numbers go down. Okay, we're struggling with Delta right now. And now with the onset of the Omicron, And another thing I didn't mention is that the Omicron variant, the reason why that's a variant of concern is the original one came from COVID-19, which was the Alpha variant. Now, the variant of concern, well, one before that is a variant of interest, which means it's controlled, which was the Alpha. Then we had the Beta, then we had the Delta and so forth. Okay, but they're cloning and they're mutating. So as they go through these transition of mutations, sometimes 2, 3, new variants will take place from the spike protein. So even though it's mutating, it's also reinventing a new variant. But the concern for the Omicron is that it has 30 mutations now at a fast speed of rate. So the impact that can spread is not a concern at the moment because it's not a concern for panic. We are monitoring this closely. But please follow the social distancing guidelines for now. Get your vaccines, get tested, and monitor and be on the alert. Okay? Because we are having a little bit more freedom than we did last year. But do not forget the principles of social distancing, please, to protect yourselves and to protect others around us. For more information about the Omicron, I suggest that you go to the Rhode Island Department of Health's website, and they have a listing of information. It's very simple. They can explain a lot of things to you, pretty much what I just explained to you. But as I said, it's too early to say too much. So right now it is under investigation and is being monitored, and scientists are moving fast to stay on top of this so that they can offset the spread of infectious disease that may come about from it. The website address to go there to see about this is as follows. And I will keep monitoring any new information that comes out from the Department of Health. And as it becomes available to me, I'll be creating this vlogs and I will be sending this information out to you. Also, feel free to contact me. You can call me. And also you can contact your family physician as well, where they can also explain about the Omicron variant. Thank you.